Good morning, good afternoon, good evening. Thank you all for joining us to the Global South-South webinar. We have a wonderful panel here who will be sharing their insights on enhancing air quality with data access and capacity strengthening. Before I hand over to my colleague Tanushri Ganguly, I would just like to go over a few housekeeping rules. Yes, the session is being recorded and we will share it with participants after the webinar. It will be available on our website on the events page. You can use the chat function to share your thoughts, report any issues. We prefer that you share your questions as well. The more questions you ask, the more insightful and impactful discussion that we're going to have. With this, I'd like to hand over to Tanushri Ganguly, who's the director of the AQLI program under EPIC's Clean Air program. Over to you, Tanushri. Please set the context
Thank
for
you
this.
so much. Thank you. Thank you so much, Farah. And thank you everyone for joining us today. I see that we have close to 70 participants who've joined us from different parts of the world. So thank you very much. And a very, very warm welcome to all our speakers who have kindly agreed to be on the panel today. And of course, all our attendees. The Clean Air program at the Energy Policy Institute at the University of Chicago is extremely glad to have collaborated with Health Effects Institute for bringing to you all this incredible lineup of speaker that we have for today's session. But first order of business, before I go ahead and set the context for the conversation today, a huge shout out to Dr. Pallavi Pant. And for most of us here, Pallavi needs no introduction, but she's the one who planted the seed for this idea of, making this panel happen. And from Epic side, again, a shout out to Farah because she's the one who's, been shepherding the process for us. So many, many thanks to you both for making this happen. I know this has been sort of in conceptualization for months, but so glad to see, this finally coming to fruition. With that, I would now like to move to setting the context for the conversation. So I'll probably do that in two parts, which is, why is it that this conversation is needed and what is it that we are trying to achieve through this conversation? So first, the why. Now, this is like preaching to the core, but air pollution kills over 8 million people, something that we all know. But 90% of these deaths primarily happened in the lower and middle income countries, right? As the UN Secretary General has highlighted that 50% of all economic growth that has happened is because of countries in the global south. The intra-south trade has also increased in recent years and now accounts for more than quarter of global trade. What this means is that the global south is together achieving a lot. But also, global south has not been very successful in curtailing air pollution as a challenge. And despite the fact that we have very similar challenges, whether it's limited monitoring, limited funding for implementing cleaner action, or limited institutional capacity, or weak or absent regulations in some case, we are all sort of plagued by these shared challenges when it comes to solving for air pollution. But this is also an opportunity for countries in the global south to come together and find solutions for these shared challenges and accelerate deployment of cleaner solutions. So that's the what part of the puzzle. That's the why part of the puzzle. Now, coming to what is it that we want to achieve out of this conversation? The idea with today's conversation is to highlight select case studies from some countries in the global south to present the best practices that have been adopted to address some of these problems. We'd also like to reflect on ways in which countries can actually collaborate to locally tailor and implement some of these solutions within their national context. So that's a little bit of the context. I know we have some excellent presentations and conversations lined up, so I won't take up any more of our time. And with that, back to you, Farah, for probably kicking off the first of many such conversations to happen in the future.
Thank you so much, Tanushri. Now I'm going to invite Dr. Pallavi Pant, who's the global head of the Health Effects Institute. Welcome, Pallavi. I'd like to hand it over to you please get this session started.
Thank you so much, Farah. And I really want to echo Tanushri's words. I think you've made this webinar really happen. So thanks for all of the work in getting this stellar panel together. And welcome, everyone. We're really excited to be able to having this conversation. And like Tanushri, I would also like to think that this is the first of many. We are going to follow, the following format for the rest of the webinar. We have two great speakers who are going to give us an insight into how, some countries and regions have addressed the air pollution problem. Then we're going to have people, other experts respond to that. And then towards the end, we will have an open discussion. So we really welcome you to add your questions for the panel, add any observations or additional ideas that their comments spark. We want to make this a very lively and engaging conversation, and we do want to hear from you. So to kick off our discussion today, I'm very excited to be welcoming Professor Nestor Rojas, who is a trained chemical engineer and a professor at the Universidad Nacional de Colombia. Professor Rojas has been working on the topic of air pollution for a very long time. He's conducted a variety of studies on sources of air pollution, understanding how pollution levels are changing over time, how they contribute to people's exposures in different microenvironments. And he also sits on the steering committee of the International Global Atmospheric Atmospheric Chemistry Project, or IGAC. Professor Rojas, we're very, very pleased to have you here, and the floor is yours.
Thank you very much, Pallavi. I want to thank Farah also and Tanushree for the introduction and for making this event happen. Okay, I'll try to share my screen. I sent the request.
Professor Nesta, I don't think I can hear you very well. If you could try speaking perhaps a little louder or adjusting the volume.
Okay. Yeah, I hope it works fine from here. All right, I want to give you or show you a very short overview of air quality in Bogota, Colombia. Bogota is the capital of the country. It's about 8+ million people city in South America, in the north of South America, and it has had air quality problems as every big city has had. So let me see. All right. Okay, so first I want to say that air quality in Bogota has been monitored automatically with robust systems and stations since 1997. And the data of this monitoring network is available for accessible by any person who wants to know. It wasn't so easy to get access to the data at the beginning, but it has increasingly been available on the web page of the governmental agency that is in charge of the air quality monitoring and management. So initially, the network had 13 sites, and then it has been expanded, and currently it has 20 sites, as you can see in the map on the right. This showed us, as citizens and governmental, and the government, how it was changing and how it was evolving at that time, 1997. And at the beginning, what we could see is that the air pollution was increasing. The main parameter was PM10 at that time, and it was increasing. And that was very worrisome because they didn't really know the causes of this. But then with further research and working together with the universities, then they started learning about the sources of air pollution and started managing much better the sources to reduce air pollution. So they realized, and we realized, that the air quality was strongly linked to ground transportation. Despite being such a big city, Bogota doesn't have still a metro system. The first line is under construction right now. So public transportation is based on buses. And as you can see in the picture on the left, the system before was chaotic. It was quite informal. So it was based on old buses, and they were poorly driven, very aggressively, and there were huge traffic jams. We still have many problems with traffic jams, but the situation has changed quite a lot. So from this system, it has taken about 15, 20 years to move to a much more organized system, as you can see in the middle and the right picture. So we have a BRT system. It may be the largest BRT system in the world, and the first system at this scale, at this large city. The previous experience was in a much smaller city that was Curitiba in Brazil. So Bogota is an example of a successful BRT system. We still have many problems, but it has been a very successful system. And then this works on the main avenues, and in smaller streets we have a complementary system that is based on smaller buses, not articulated buses, as the BRT, and they share the roads with the private vehicles, passenger cars, and trucks. So it's much more organized. And recently, in 1919 and 2019, there was a renewal of the fleet, of the bus fleet. So now we have a very good share of electric buses together with low emission buses and articulated buses based on natural gas and diesel buses with filters. So that's what we have now. Recently, in 2022, this study by my colleague Ricardo Morales and his team showed how the change in the fleet, renewing the fleet of the public buses, reduce the concentration and the exposure, of course, of passengers to black carbon. That is one of the main components of particulate matter. So this showed how this bus renewal was very effective to reduce this exposure and, of course, health effects. Thirdly, I will say that research has contributed a lot to building the air quality management plans. The government has hired universities and has had research initiatives that have contributed to determine the source apportionment, which sources are the most important to air pollution, especially to particulate matter. Uh, Emission inventories have improved quite a lot in these 20 plus years. And also air quality modeling has been important to make better decisions. This has led, for example, to a much more strict control of emissions in the industry, changes in the fuels too. A lot of industries that used to burn coal, for instance, moved to natural gas, which is much cleaner. And we also have a cleaner bus fleet, as you saw, and better diesel fuel too. In the graph, you see that still we have uh, important sources to particulate matter that haven't been controlled enough. So we have a lot of resuspension from the roads, for example, and also by the wind. We have a large component of secondary organic particles and secondary particles in general. So that's very hard to control because it depends on the emissions from away from the city, for example. But we still have a large component, nearly a quarter of the particulate matter comes from road transportation and from the industry too. So as a result of all of this, we see in this graph the evolution of air pollution, particulate matter, PM10 in the black line, and PM2.5 in the red line. As you can see, PM2.5 monitoring, regulatory monitoring started much later in 2014. But we have enough data to see how it has evolved. So these are the aspects that I talked to you about. This is the introduction of the BRT system and an increase in diesel use caused by the use of the BRT system, the transition between the old bus system and the BRT system. In 2007, there was an important event that was a Clean Air Pact, and that started. It was between the governments of Bogota and Medellin, the largest cities, and the ones that had most polluted air, and the company that produces the fuels. So the pact was, let's improve the fuels so we can have cleaner buses in the city and cleaner vehicles. So that helped to reduce the sulfur in diesel. In 2008, it was reduced from 1100 ppm to 500 ppm, and then there was a further reduction to 50 ppm, and currently we have a diesel with 15 or less than 15 ppm of sulfur. Also, gasoline was improved. In 2011, there was the air quality management plan that had already introduced the results from research studies and the source apportionment studies. So we knew much better what were the sources. Then we had this improved non-BRT bus system and the BRT fleet renewal in 2019. So as a result of all this, we can see that the effectiveness of the measures and how we can actually be successful in reducing air pollution. We still have many problems. In the last years, we have observed an increase in the number and the intensity of local and regional wildfires. In this picture on the left, you can see one of the local fires in the mountains that are on the side of the city, and that increases air pollution a lot during the days of the fires. But we also have regional fires that are much farther and that also affect air quality in the eastern cities of Colombia on the Andes Mountains. We have seen a huge increase in the number of motorcycles that are not very clean. The emission standards of the motorcycles that are coming to the country is not very high. So emissions are quite high. Also, we have old trucks and construction machinery. You can see in the middle picture one of the examples of these old trucks that emit huge amounts of smoke. We also have old private buses, and for example, the school buses are not clean, which is very worrisome for our children. And we still have a high component of particles from resuspension and secondary particles. So we still have a lot of problems to tackle. So I hope this short presentation contributes some ideas to for this conversation. Thank you.
Thank you very much, Professor Rojas. That was an excellent and short and quick overview of all of the work that's gone in Bogota. I think Bogota has also been an example for many cities in terms of transport planning and urban design. So it's really interesting to see this change in the air pollution levels over time. I would like to now invite Dr. Beatriz Cardenas, who is the team lead for air quality at the World Resources Institute. I think Beatriz needs no introduction, but for those of you who may not be familiar with the many wonderful things she's been involved with, she was the General Director of the Air Quality Management Unit in Mexico City's Secretary of Environment. So she clearly has looked at this from the policy perspective. And she also, prior to that, led the air pollution research area at the National Institute of Ecology and Climate Change in Mexico. She's written a lot of research papers, participated in many global air quality projects. So, Beatriz, the floor is yours.
Thank you. I think it was a great presentation. I think Dr. Rojas summarized the very interesting and very effective path that Bogota has followed over the last years. I think it shows very well how not only data, but also interventions, particularly the ones that he mentions about transportation and fuel, make a big change. Even when the transportation, as is the case in many cities, as we know, is one of the main sources of pollution. There are other sources, as we know, but starting with the transportation and the case of Bogota, it was a very good example for many cities in Latin America. It has many similarities with the Mexico City metropolitan area, I will say, in which also transportation was identified as a major source of pollution, but many changes were done as well. The BRTs, as Dr. Rojas mentioned, was one of the main intervention. It was a good example that also started in Bogota. And fortunately, with this monitoring data that Bogota has established and kept in operation and expanded, we can see with the ambient concentration how this intervention has affected or impacted positively the ambient concentration. The challenges are still there. I mean, the cities in Latin America. Latin America is one of the most urbanized region in the world. So many of our cities that used to be small now are medium. The mediums are getting big, and the bigs are getting megalopolis. So the challenge is still there. And I think this also shows a very good example when transportation sector and environment sector works together, or at least there is a reason why improvement in transportation should be going faster. Seeing the data with the monitoring network that now Bogota has, it shows also why this legacy of data, good quality data and open data is so important. So researchers like Dr. Rojas and many researchers can also use this data to identify make the fact that some progress has been done and what progress needs to be done. I think now we have the good opportunity of working very close with the transportation experts and identifying what is the data and what is the analysis that we need to do together to show that moving faster to clean transportation, not only clean, but also affordable, accessible, and having access to everyone. That's what we want with a clean and accessible transportation. But the most important thing is just showing how not only ambient concentration gets changed and then therefore the exposure for many people, but particularly those who are using these transportation systems, like the example showing the exposure to black carbon. There are other studies also in the region that I think that shows very well when these efforts are done. People that uses this transport and spend a lot of time on them get a big benefit in their by reducing their exposure, improving the quality of these travels. They get faster, but also the exposure that you get, the concentration gets much slower. I think that there are many examples in many cities that could follow this, is that there is no question, and there is a lot of impact and good results when the cities invest in good transportation. And then environmental experts, particularly the atmospheric scientists or air quality or health experts, work together and make the use of this data to keep pushing for an expansion of this clean transportation and affordable, as I mentioned.
Yeah, thank you so much, Beatriz. I think all of the points you're making are so relevant, especially the idea that, availability of data and using it to make the right arguments, because also trying to highlight what the progress may have been and where advancements have been made can be a really strong motivator for action sometimes, versus talking about, how bad the situation is or all the ways in which we haven't made progress. So thank you again. I think we're going to move now for a few minutes to another continent, which is Africa, a place where urbanization, of course, is rapidly happening. We are expected to see more and more people living in urban parts of the continent, and the population is still expanding. There's a lot of young people in the region, and there has been a lot of conversation around the issue of air pollution, what the appropriate interventions might be, and where we can make progress. And in fact, on some issues, African cities and countries are actually taking leadership, where we're not seeing, the same level of engagement in other parts of the world. So I'm very pleased to be welcoming Dr. Khadi Thiam, who is a pulmonologist and an oncologist in Senegal. Dr. Khadi has a master's degree in public health with a specialization in environmental health, and she's worked on topics at the intersection of environmental exposures and respiratory health. She currently is a professor at the CHNU Defan University in Dakar in Senegal. And Dr. Thiam, we're very pleased to have you here, and the floor is yours.
Thank you so much. I'm so happy to participate in this scientific meeting. It is very interesting, and I hope you will understand me because my English is very bad, and I try to explain to discuss with you. And I'm so happy to talk about pollution in Dakar, especially in pollution in Senegal, especially in Dakar. Pollution is contamination of the indoor or outdoor environment by pollutants. Pollutants may be of various kinds. It can concern the outside air, but also the inside air, where we spend much more time. And these pollutants are particulate or gases like sulfur dioxide or fine particulates or carbon monoxide. And pollutants can be of natural origin, in particular sun dust from the Sahara Desert carried by air to the northern region of the country, and bush fires occur during the dry periods and heat waves. Pollutants of anthropogenic origin are mainly produced by the automobile sector because we have a car fleet obsolete, growing, and that causes a lot of traffic jams every day. Maybe pollution may be related by industrial discharge, like this picture. And we have pollution due by fuels for domestic use because in Senegal we cooking by biomass and biomass for cooking activities, house free general resort like this or in the outdoor. Another source of pollution is open high burning of garbage, like the garbage dumping in Dakar. And in the air pollution source, indoor pollution is due to biomass energy, like the smoking tobacco or smoking secondary of biomass or secondary of domestic use. Therefore, the indoor air is 5 to 8 times more polluted than outdoor air, and when it is not well ventilated. Extent of air pollution can cause impact on human health, but we have threat to the environment or economic and social consequences, mainly like and 7 million of deaths from all causes in 219 is causes by air pollution. Mainly like to air pollution, which occupies 10th place in the risk of avoidable death with 2 million annual deaths, especially among children under 5 years, because children can present acute respiratory infection. In Africa, 1 million annual deaths is secondary to air pollution, more than death to malaria or smoking. And 2,000 million people cook every day using open fires or simple stove like biomass. According to the WHO, in 2019, the population live in place where the safe house recommending in the world higher quality guidelines were not met, like low and middle income countries like Senegal. And in Senegal, we have since 290 from the Quality Management Center of Air to have air quality measuring station every day. We have a 6 station measuring in the country to measure pollutants like gaseous or particulate. We have every day some or more of pollution like particulate or gases, and the central quality of air takes the air quality every day to inform the population. All organs can be affected by air pollution, but according to the proximity of lung and environment, we have more than disease on the lung secondary of pollution because we inhale 15 cubes meter of air per day. And the air inhaled, including pollutants. If you are in indoor pollution or outside of air, we can have disease caused by pollution and the impact of respiratory health can be diagnosed on the short, medium, or long time. But depending to the extent of exposure, duration by exposure, properties of particulate, and physiological conditions. We know, therefore, we have some vulnerable groups, including the patient we have chronic obstructive pulmonary disease, patient we have diabetics or asthma, and the children, and those patients we have another chronic disease like cardiological disease. It is very difficult to determine what is the health impact by pollution because we have a diversity of epidemiological methods using. Study may be done at a different location, and the air pollution is very complex. We have some more pollutants, and the health status and study is very difficult to know, and the disease that may be linked to air pollution are multifactorial. Therefore, in Dhaka, we have done some studies. Some studies help us to know that the air pollution can cause a lower respiratory condition because exacerbate asthma or cause asthma, and the air pollution can be associated with acute respiratory infection. Impact of respiratory health is now by the study to do in children at the hospital children, including 1,014% children that we know incidence of asthma attack is increasing sharply in children at this hospital children. They occur mainly during the dry season, and the increase is strongly correlated with air pollution PM 2.5 because PM 2.5 can go to the under air respiratory and causes disease. Another study due at 2014, including 3% patients, maybe no, a close relation has been demonstrated between export to air pollution linked to car traffic because in the same area, acute exacerbation of asthma were more frequent during the peaks of particulate pollution noted in the first and last quarter of the year. We do another study of collaboration of pediatric nurse and internist nurse and cardiological nurse. And the study, we know that asthma is very prevalent, more than asthma on the north region of Senegal. We have particulate come from the desert, the Sahara Desert. And on this study, we know that the impact of respiratory health like COPD, chronic pulmonary obstructive disease, we have it after air pollution secondary of automobile pollution. And locally level, we recommended that the population to do not product pollutant and to take a facial mask if we have a pollution, and during to observe the treatment when we have pollution, and to take medicines every day, to go to medical doctor if we have a chronic disease. In conclusion, pollution concerns both outdoor and indoor air. It can be due to human action, known and anthropogenic, or linked to natural phenomena. Exposure to this air pollution contributes significantly to the occurrence or even worsening of chronic respiratory disease, such as asthma, emphysema, or chronic pulmonary obstructive disease or cancer. Consequently, the fight against air pollution is urgent and involves controlling the source of pollution. Thank you for listening.
Thank you very much, Professor Thiam. This was, again, an excellent overview and such a contrast from, the major sources that we were just hearing about in case of Bogota in Colombia and here in Dakar, Senegal. So thank you for sharing, both your work and what's happening in the city. I would now like to welcome Seneca Naidu, who has been with C40 for several years and is the technical head for Breed Cities Africa. She has worked with several cities across Africa, thinking about integrating air quality solutions, thinking about health and local air quality actions. So the floor is yours, Seneca. And Dr. Thiam, can I please request you to stop sharing your slides so that we can see everyone back on the screen?
In Senegal, we haven't to school for students, but some nurse can.
Okay, yeah, we can try and do that on our end. Seneca, the floor is yours.
Okay.
Yeah, thank you, Pallavi, and thank you, Professor Thiam, for that very interesting presentation. I think, it gives everybody a little bit of insight. We're having this conversation about data and potentially what it means for the work that we're doing in Africa. And I think it gives everyone a little bit of insight into sort of the conundrum that we're sitting with in that, where Dr. Rojas presented on sort of the very extensive, and although, additional work needs to be done, the very extensive sort of monitoring network that exists within Bogota. This is not always the case for many African cities where some of that doesn't necessarily exist. But I think the more important one that Dr. Thiam has mentioned in her presentation is the fact that there are institutions like the one that she's part of in Dakar that are obviously doing sort of substantial work in gathering health data related to air pollution, but this doesn't always filter down into sort of the policy making that's happening at a city level or even a regional and country national level, right? So something that I wanted to mention here is that, just sort of bringing it back to the topic that we're discussing today, I think one of the really important things that we need to remember, for making sure that we are able to clean the air is we need to make sure that we're forming these strong sort of partnerships, not just between cities or between countries or at a regional and national level, but also at a more local level between different city departments, so that when, it comes to having sort of integrating horizontally and establishing those relationships well, we are able to then share data across different departments. I think, we can see how important, as Professor Thiam has shown, how important it is to have that data so we're able to see the type of impact that air pollution has on human health. And making sure we're forming these sort of strong partnerships will allow us to as say air quality staff within air quality departments have access to this health data, then can then be incorporated into different research projects, and then eventually policy that's implemented within different cities and countries. So I think that's the one thing that I wanted to point out, and then maybe just zooming out a little bit, if it's okay that I talk to Dr. Rojas's presentation as well. I think although you have mentioned, Pallavi, that there's a contrast obviously within the sources that were mentioned in the two presentations, where Dr. Rojas focused a bit on transport, and Professor Thiam focused on sort of indoor and outdoor air pollution associated with domestic burning. Professor Thiam did also mention some emissions associated with transport. And I think the other important thing I think to remember here is that, I don't think any of us are strangers to this, but it's becoming increasingly evident that air pollution and the climate crisis go hand in hand, right? And I think Beatrice, my fellow panelist, will obviously hopefully agree with me here, but I know she's done a lot of work in the development of integrated inventories. But I think we can all agree that both issues need this sort of collective action to both and immediate action to both improve air quality and mitigate climate change. So in many African cities, and I'm sure other cities in the global south as well, where sort of both financial and human sort of resources are constrained, it makes sense to tackle these issues simultaneously, because a lot of the drivers and the sources are the same, right? So, and the impact of each of those exacerbates the other. So it's almost like a next logical step. So I think the point that I'm trying to make here related to a sort of collaboration, again, happening at that internal level where, potentially some of these silos, and I know for a lot of the African cities that we work with, these silos do exist between, different city departments and at a regional and potentially national level, is breaking down some of those. So, at zooming in a little with this, what we're trying to talk about today is collaboration, and whether it's between, cities in the global south with other cities in the global south or countries in the global south, it needs to first happen at that local level before it can move out. So that's an additional point that I wanted to make there. Thanks, Pallavi.
Thank you very much. I think you're making a number of really excellent points, starting from the need for those partnerships, and also to start them at the very, very local level. And we are beginning to see lots of questions in the Q&A box, but if we can just bring this back to the idea where we started, and the piece that Tanushree talked about at the very beginning, that we are looking at this conversation as a place to see where are there examples in the global south, interventions, actions, ideas that can be applied in other places in the global south, especially considering that often there is a similar paucity of resources, perhaps not enough staff members, perhaps not established frameworks for coordination across departments. And we had an excellent question from one of our attendees, which I would really like our panel here to respond to. So if I can first request everyone to turn on their cameras if possible, it'll just be nice as we move into the discussion and conversation section of this webinar. But the question was that if there are common characteristics between South-South countries, then can the strategies that have worked in one be adopted in another without a full understanding of the background levels of air pollution? And will those adopted strategies be helpful in mitigating air pollution? So I think, in simpler words, if we were to see a successful example in one place, we don't yet fully understand the sources or the levels of air pollution. How likely is it that that strategy will work in another city or country in the global south? Beatriz, I'll perhaps start with you, and then others on the panel, I would also like you to respond.
Well, I totally agree that air pollution and climate are coming together, and I think that there is a good opportunity now to see and to have an integrated point of view instead of keep separating, oh, you work on climate, you work on air pollution, you work on health, and you work on transportation. I think that's a new vision, and I see more and more among experts from the different with the different expertises that talk together. I think the other question is about the sources. I mean, the example, and I imagine that Nestor will agree that many of the sources that we saw that are contributing to the air pollution in Dakar are very similar to the ones that we are seeing in many Latin American cities, even in big cities. Transport is so obvious, is the usual suspect, and we have to do something about it. But I think there are other sources that we have to ask among ourselves. Is that still happening? Oh, that's happening. How do I cook? How do we heat our water? How do we manage our residues? I think that's a very good example. Waste burning is happening everywhere, even though it is prohibited. So I think that's something that we have to ask. And I think that's one of the first things. We don't need to have ambient concentration to know that is something that is, I mean, of course, it helps a lot. But maybe some questions of what are the sources that are in my city that may be contributing to these health problems that I'm seeing. The first thing is asking about transportation, and I think that comes to the question: have something that Bogota or Mexico City or maybe Santiago done over the last 20 years will work in my city? And the answer is yes, it will. The phases or the steps will be different, and that will depend of, I think one of the main question or main issues that we have to really think about is the fuelability, availability. Do we have a fuel with low sulfur that then allow us to go with cleaner technologies like Euro 5 or 6 or even 7? Right, so these steps are important to ask, and then what will be the investment? But I think that's how the request for clean air matches the potential solutions that are there. And then even if we are focusing on transportation, for instance, that's something that the cities have to do. There are other sources that we need to tackle as well. And I think the issue of how we manage our residues is important. Either we will have methane as a result of production being produced by anaerobic digestion if they are not well managed, and then we will have ozone as well as other issues in terms of global warming. But the waste burning, I think, is something that we still have not tackled. So I will say yes, there are many actions that many cities have taken over the last 2 decades. In Latin America, in Africa, and Asia, we have a lot of common sources. And I think that's a first step. Do I have some of the sources that I'm listening that other cities are still having, and how they have tackled? I think the road dose is a very important issue, a very important source that we tend to forget when we talk to the global north, because that was a problem 30 or 40 years ago. And in some cities may be a problem. But in the global south, that's an issue that everyone is facing. And there are solutions. And I think that, by the way, Bogota has a very good example of the clean air zones, identifying what are the sources that are affecting low-income neighborhoods. And the first one is our streets are not paved, for instance. And that's something that Mexico City did over the last 20 years, is paving roads. And of course, later it comes the cleaning and avoiding the resuspension of whatever is impacted. So I will say, yes, there are a lot of experience that can be shared. Of course, they have to adapt to the conditions and situation. But I think that the first one is just, do we have the common sources? And what solutions have some cities have implemented? And it was already mentioned, this collaboration, this networking first among different experts from different disciplines. I think that also has come as a very good success story in many, I will say in many cities in Latin America, that's happening. The scientists working with decision makers and with experts from NGOs, as well as from the the private sector. So I think that's something that we have to promote. Thank you.
Yeah, thank
Thank
you.
you.
Thank you. Other comments on this, and I will also mention for any of you who are listening to the webinar right now, and you're thinking about what are the solutions and where do I find them, there's actually a series of really excellent resources that C40 has produced. There was a document that Vital Strategies produced last year looking at case studies of successful examples. If you are looking at, what are the solutions that I can use, then please do contact people here on the screen and we can point you to the right resources because those already exist and are available and you can learn from them. Okay, any other reaction from our panel here? Yep, please.
Thank you. So I 100% agree with Beatrice, but I will say, in an ideal situation, and of course, in the Global South, we don't always have the ideal situation, but in the ideal situation, we want tailored solutions for the local and regional context. And that is not always possible. So, to answer this question, I think there's a couple of things that we need to do. I think we need to take a closer look at the common characteristics, right? Because there's so many things that need to be considered. Population size, geography, there's tons of characteristics that I think need to be considered, and potentially whichever city or group is trying to implement a similar solution, there will be some background work that I think that needs to be done before you're able to take one strategy or intervention from one city, say, and implement it in another. But and I've mentioned this already, I think, in many of our cities, and I'll speak to cities specifically because that's who I work with on a day-to-day, where there is sort of this resource and data constrained environments. This can sometimes be an option, and I think a very good one. We often turn to best practices and even the use of proxy data from global north cities when specific interventions haven't really been tried and tested in the global south. And I think that's fine to do. But, we're trying to implement more ambitious solutions in the global south. And I think the cities in the global south are really starting to take these sort of bold strides and sort of leaving their comfort zones to implement more ambitious solutions. And where that is the case, then I definitely think, we should start trying to take those best practices from some of the global south cities as opposed to some of the global north cities. So I think it's great to sort of have these lessons through these sort of well-established policies and programs that other cities or countries have been able to implement. But where possible, it is obviously, we want to try and tailor the solutions to a local context. But again, like I said, that is the ideal situation, and we're not always in the ideal situation. So I agree that I think this is a possibility, but there is some work that will need to be done, and it can't just be sort of a copy-paste exercise, even in a sort of south to south context. Thank you.
Yes, Professor Thiam.
Thank you. And I try to comment someone. I know that the air pollution are not borders, and therefore, if you have pollution in Senegal, we have pollution in another country. And in Senegal, first step is to know what is higher quality. To have measuring of higher quality in Dakar. And second step is to know higher quality out Dakar. And three, we try to have some study help us to know what is the disease can causes by pollution, and try to implement a solution like we have beginning because we don't communication every day to try to explain population that air pollution is good or medium or is very bad, to help us to manage make facial mask or cooking out or don't take exercise out if you have a pollution, because information is done every day with concerning high quality. And we haven't now we haven't exhaust gas control of pollution, and we haven't institute to teach pollution, but pulmonologists try to done more study, because we have a proximity and lung and proximity lung and pollution.
Yeah, thank you. Thank you so
Policy.
much for highlighting those. Nestor?
For me.
Sure. I'd like to say that despite we have shown some success stories about reducing air pollution through successful policies and measures from the government, there are some other areas that have been uh, abandoned by the government. We have a huge inequality in many of our countries. So many areas, even close to the large cities, uh, uh, don't have good monitoring, don't have good, a strong government that is interested in reducing air pollution. So in that case, I think that it's very important that the community, the citizens, and the researchers make use of affordable technologies, low-cost sensors, for example, to start measuring by themselves and start increasing awareness and start pushing the local governments to do something about air pollution. So in rural areas, that's the case too, where they have to use biomass for cooking, for example. So we can learn from other countries how they have started using solar panels and some other clean technologies that are that can actually substitute those energy sources. Uh, so yeah, that's something we need to promote the use of these sensors and citizen science to promote this, to increase awareness and push the government.
Thank you. I think that's a fantastic point. And, also another example of where we can have sort of learnings and lessons from what is happening in, one place and trying to replicate it elsewhere. I think one example of, using low-cost sensors and using them effectively has been like one prominent example, I would say, has been in South Asia, in the country of Pakistan, where, one person's efforts to set up low-cost monitors really led to a whole series of events which have since meant that there was court intervention and the government was asked to prepare plans addressing air pollution. So it can really go a long way in prompting action, or at least getting the conversation started. There was another question in response to your presentation, Nestor, and I think it gets to a really important point. So the question was about whether the investments and the transportation that happened in Bogota were a result of air quality concerns and the data that was coming from air pollution studies, or was it a part of the general urban planning efforts in the city? And I think the larger question that I would also ask others to perhaps comment on is, how do we create that demand? What has worked? When and how do cities get ready for air quality interventions and decide to prioritize that? So Nestor, we'll start with you and then hopefully hear from others.
Sure. I think that the main motivation for the changes in transportation was the quality of the transportation itself. So people were using very uncomfortable buses and taking risks even uh, when they used these low capacity buses, the poorly and aggressively driven with lots of emissions and so on. So at the beginning, the motivation was the quality of the transportation. But then people also were aware of the air pollution problem caused by the transportation. When um, some other alternatives were being taken into consideration, then many people started saying, "Oh, hey, okay, the next buses need to be much cleaner than the previous one." So, and also the data that were started being gathered at the monitoring and at the air quality monitoring station supported that decision.
Any other thoughts from our panel on, what can motivate action? And I think I'm also curious, similar to the Bogota example, are there other examples of where interventions were brought with perhaps a different motivation and then eventually helped improve air quality and then became air quality interventions as well? Are there examples like that we could, point to? Beatriz.
If I may just so also highlight the importance of yes, many big cities or in many big sources are very easy to be identified. But I think that the issue that Nestor raised about the inequity that we have in our cities, in our countries. I think this is important to consider that while we recognize that there are some solutions and efforts that have been successful, there are some parts in the city, there are some groups of people that have not been seen as the priority. And I think that's something that we are seeing more and more. People in vulnerable situations or susceptible people, I think that's something that we have to focus. So, and I think that there are some sources that we know that are affecting the most this group of people. And I think that we just have to consider that in our designs of solutions. And I also would like to raise the case of the civil society. I will mention that, for instance, in Mexico City metropolitan area, yes, there have been so many policies implemented over the last 3 decades. But the important thing is what the civil society, including experts from the scientific community, as well as civil society in general, NGOs, local NGOs, have made a very important, and health experts, of course, have been raising their voice to ask for actions and present whatever there is information. May not be the perfect information. I agree when you see a monitor network like Bogota, Mexico City, say, yeah, that took so many years, but the civil society was a very important, it played a very important role in asking for data and then solutions, and then also information to see if these solutions have been successful. And sometimes we just know that some solutions have been implemented, but we don't have the time nor the data to show how good they were and why it's important to do. So I think that considering the participation of civil society and even the media, there's a question about, do we have some examples of when some information or misinformation campaigns have done some issues, some impacts. And I think this is, again, coming back to what data is available, is that what data is there, or how other experience from other places have shown that this is causing an impact. It's great to have data on health impacts in our cities, in our countries, but we know that the exposure to these air pollutants are causing so many problems. So also targeting to one source as the only cause of causing the air pollution, it might be disinforming others. So while we know for air pollution events, for instance, high pollution events, some sources are playing an important role, of some meteorological conditions. So while it is always important to be in a very good open situation and also trying to communicate better with media, I think that also have shown that, yes, let's target on the problem right now. Maybe it's a forest fire, maybe it's agriculture, maybe some stagnant condition. but what sources or what solutions can we tackle in this specific case? And while focusing on a very specific source helps a lot, also sometimes makes that everyone forget about the other problems, the other sources that we need to tackle. So I think that's a good thing, is that when, again, coming back to when we work together and we are open and we discuss and share the information, I think it's important. And the media has been playing a very important role, and I think we have to get closer with that. We have a very good experience with the Cleaner Catalyst, working with the media and trying to share the data. And I think that's something that we can also learn from that.
Tanaka.
Yeah, thank you. So I think the point, so I have 2 points to make. So one is related to your question about, what solutions have been implemented that were not necessarily air quality solutions, but, have either turned out to be or have some sort of impact on air quality. And I think the one that's come out quite strongly in a lot of the African cities is sort of greening initiatives. So trying to make a place more livable, especially for these communities that are more sort of vulnerable, that have been disproportionately impacted by climate change and air quality. So as a solution for that, but then also, a solution for rain runoff, a solution for shade and climate and, greening, decreasing heat, the works, right? But and that has sort of turned into something that was more sort of climate focused, and now there is there is an impact. It is having an impact on air quality as well. It, of course, does lead to a very different conversation, which is probably not for today, but on ozone and what it means for which trees are planted in different sort of urban spaces and the impact that it has on ozone. But, that is a conversation for another day. So I think that's one that has come up quite often is the greening situation. And then the other point that I wanted to mention is, on the disinformation. So I don't think this case is necessarily disinformation, say, from a city government, but potentially something that happens at a more sort of behavioral and cultural level, that has come up, I think, in some communities in different African cities, where the disinformation comes from, the community itself, where the advice is, cook on wood, or cook using wood, it makes your food tastier. So I think that's another sort of issue that we need to tackle with how we message, the type of messaging that we're putting across, the type of audience that we need this messaging to get to, and sort of how they take that in and how they sort of reflect and how that changes their behavior. So I think that's also something that's really, really important. I think just generally across the board, it can't be a one size fits all sort of messaging for people. The messaging needs to be tailored, like I mentioned earlier with the solutions, to the type of audience that you're hoping that message, that will receive that message. So yeah, not necessarily disinformation, but I think an issue that we have related to information. Thank you.
Yeah, thank you so much. That's a good point. And Nestor, please go ahead.
Thank you, Pallavi. Regarding the misinformation or disinformation issue, uh, actually, about 10 years ago, 11 years ago, there was an initiative from the local government to start a project on the retrofit or on retrofitting buses with particulate filters in Bogota. So we could assess how much of the emissions could be reduced by using those filters. And there were some I know of individuals or maybe a group of people who started saying openly that those filters just didn't work, that they were a hoax, and they were not useful for cleaning the emissions. So actually, we had to engage in that kind of discussion in social social networks and so on, to show that actually the scientific and technical evidence of the effectiveness of those filters were there, and they were not possibly hoax in any way. So yes, sometimes we have to do that.
Thank you.
To combat misinformation.
Yeah, thank you so much for mentioning this. I think, there's potentially examples from different places that can be similar. One other example, perhaps from India, which is not so much a deliberate misinformation campaign, but essentially not having the right facts and information and making decisions, is the use of smog towers. And I think someone here also had a question about them, and they have been promoted, or at least discussed in very serious ways, with budgets allocated in several Indian cities, with the idea that that's what will solve our air pollution problem. And it has taken a lot of dialogue between the scientists and the civil society. And of course, there are going to always be some vested interests who want to set up these smog towers. But there are also those types of false solutions that can sometimes get promoted and can get a lot of traction. And those are some things we need to guide against. One similar question, or a sort of, building on what we've been discussing, that one of our attendees had for Professor Thiam, but I will start with Professor Thiam and then maybe ask all of you to comment on it, is we're talking here about some successful case studies. We're talking about things we need to be cautious about. But how do we now go to the next step? What do we need to do in order to have coordinated regional action? How can we bring those different people together so that there can be better understanding of what works, what hasn't worked, what we can learn from? And Professor Thiam, if I can start with you, if you have any ideas on what steps could we take to get towards more coordinated action, and then any of our other panel members who would like to add their thoughts to this as well. Professor Thiam.
Thank you so much. I know to say before take my response, but the government don't give facial mask to people. And but the government subsidized the medicines for patients we have chronic lung disease like asthma and COPD. And we began to start the control gas of the bus, of the car. And in the project, the government think to renewal the car, the automobile car in Senegal, because his automobile is very, very age along. And in the department, in our department, we know to do large studies to know what is exactly the disease caused by pollution, and the short time or long time. If pollution done asthma or COPD or lung cancer, what is really the disease caused by pollution? Maybe outdoor pollution, but especially indoor pollution, because indoor pollution affect a lot of children, affect wife, because we cook with biomass. And after this, we think, we take what is solution to stop the disease caused by pollution. Thank you.
Thank you very much, Dr. Thiam. Any thoughts from other panelists on ways to motivate this coordinated action, or any examples of how this has been done in any of the regions already?
Now, we take the air quality received by the center to evaluate the quality of air. And with government, we give this information to people to help her to take facial mask or to take medicines or to don't go out if you have pollution. And we don't information by television or FM to inform the population what the consequence of pollution.
Great, that's wonderful. Hopefully more cities can do that kind of work. Nestor and then Beatrice.
Yeah, what I can say is that in the research community, scientific community, we have had quite a few examples of collaboration, research collaboration mainly, mainly in the region, in South America or Latin America, for example. Several projects have been followed this regional approach in different aspects. For example, particulate matter characterization and source apportionment, air quality modeling, emission inventories too. So there are several examples of that. We haven't collaborated much yet with Africa or South Asia, but we have started quite a few exchanges, scientific exchanges in conferences and so on. So I said that in from the research aspect, we have tried to do that. We have been doing that. We need to expand those collaborations and also be open enough to start that kind of exchange with citizen groups, for instance, and with NGOs. We need much more communication with NGOs and citizens to let them know how our results from research can be useful for their activities and their events and their initiatives to push governments to do the right thing, basically.
If I have initiative?
Yes, Professor Thiam, I think since we're very close to our finishing time, I'll maybe give a quick opportunity to Beatrice and Seneca to add some thoughts, and then we can come back to you for a closing remark as well. Beatrice.
Well, very quickly, I agree that there are a lot of opportunities. The scientific community, as Nestor mentioned, they are sometimes well connected. And I think that what we have seen is that when we include different stakeholders in these discussions like this webinar, I think, and congratulate you guys to organize this. We have a good experience on the communities of practice. We have Latin America and Africa focusing on starting with one problem. We started with air quality forecasting, for instance, Canary Alert. And I think that's a good example of when we have a tool, a data to share, and then we share how others are using or how others are having this need. I think it's very important. And I think one aspect is, yes, let's focus on solution, let's focus on how's the ambient air that I'm exposed to. But the other one is when I know that there's some exposure, what can I do? And I think this communication with the citizens is wearing a mask, avoiding or changing the cooking area, or trying to avoid certain areas, or not being exposed at certain days, hours of the day that change the exposure. So I think that we also have to work a lot on, in addition to the solutions, one solution is to prevent exposure when bad air pollution is there or when high pollution events are coming. So the communities of practice, we have a very good experience of being an area in which different stakeholders share their views and share and learn a lot from each other. Thank you.
Seneca.
Yeah, thanks, Pallavi. I'll be quick. I think we have a lot of, maybe not a lot, but we do have some sort of regionally focused, groups, or like Beatrice mentions, community of practices. But I think these sort of gatherings are actually what we need a little bit more. When it's only regional focus, then we have a smaller pool to potentially engage with. So cities are hearing about some solution that's implemented in another city, and that's a city that they turn to. But actually expanding it out to other regions in the global south means that we have a bigger pool that we can potentially connect people with. So I 100% agree. I think this is a good first step, and I think, you know, more opportunities like this I think would be very useful. For us at C40 specifically, we are planning to facilitate a lot more, you know, between regions of peer-to-peer exchanges through our clean air network, and you know, communication will go around shortly if anybody is part of C40's clean air network. So yeah, we're also hoping to do a little bit more of this so that we can make sure that we are turning to other global south cities for best practices a little bit more than we have been in the past. Thank you.
Fantastic. That's really wonderful to, hear, and also a great place for us to perhaps bring this conversation to a close for today. As we've all, I think, said, this is really a first step. And any of you who are also just listening to the webinar today and would like to get more actively involved in this discussion, please get in touch with any of us. I think we're all very keen on taking this conversation forward, and look forward to other sessions in this series as well. And once again, as we close, I would like to thank all of our panelists for taking time and sharing their thoughts and expertise with us, and to Epic for collaborating with us and helping make this first conversation a reality. And a very, very big thank you to Farah for really being the person that brought us all together. We would not do it without her. So thank you, Farah. And we'll see you all again very soon. Thank you, everyone.